So this is the intervention room and the main room. So if you're an audiologist, you're welcome to stay, but you're in the wrong room. So if you want to go back to the audiology group with Chrissy, then refer to your email and go back and get on the right track.
Real fast, Becky, so I can see your recording on your end. It has recording paused on my end, but that might be from my other recording.
It is. And so you're going to hit stop recording on your end, and then it will convert.
Okay.
Okay.
Cool. All right, I think we're good.
All right.
Okay, so I'm going to go ahead and have everyone back.
Okay, you're good to go.
Okay, are you coming back for the breakout rooms?
Yes.
You will. Okay, so like 1:15.
Yours are first. I'm going to stay in your room until your breakout rooms go.
Okay.
And so let me answer a question about the breakout rooms. I assign them, and you will immediately it will take you immediately to your room, and it will take you out and put you back in the session. And Sarah, can you remind me how long they are? 10 minutes, 15 minutes?
Just like, let's do 7 minutes. They're not very long.
Okay, all right.
Okay, can I go ahead and start? Okay,
you're good.
All right, welcome back everyone. I hope you all had a good lunch. So I'm gonna go ahead and share my screen and we'll dive on into assessment. Okay, there we go. So first off, why assess? So we have a couple reasons why we need to do assessments. Often if it's a new family, you're doing a baseline evaluation to determine if the child needs therapy, determine if the child qualifies for an implant, etc. So doing a baseline evaluation to determine the presence or absence of a delay or disorder. But then we also do evaluations. At our clinic, we do them every 6 months. I know some places do them every year, etc. But to monitor progress. And at the end, you're going to do an evaluation to determine that the child is now at the same level as his or her hearing peers. So I want you just to consider, are your current evaluations truly providing you with all the information you need, specifically about your bilingual or monolingual Spanish-speaking children? And so for me, in the beginning, the evaluations that I was doing were basically just to serve the purpose of getting insurance authorization. Then had to really consider, is this really providing me with all the information I need? So we're going to talk about both the formal assessments and also informal assessments today. And I love this quote by Maya Angelou: do the best you can until you know better. And then when you know better, do better. And this idea of unconscious incompetence. So honestly, when I started this position as a bilingual SLP, there was so much I didn't know that I didn't know. So that's that idea of unconscious incompetence. I wasn't even aware of how incompetent I really was. I thought, I graduated grad school, I'm getting my C's and my listels, there's so much I know, but really there was so much that I didn't know when it came to working with really culturally and linguistically diverse families. Okay. So how to assess? So it's important that as professionals, we're able to identify strategies and solutions for evaluating children who are diverse. And so we're going to talk both about monolingual Spanish speakers, but also dual language learners. And in general, don't translate assessments. There are significant barriers to translating assessments because the languages differ. So you can't just take an assessment that was normed for English-speaking children and translate it into Spanish. Well, one, the norms wouldn't even be accurate because it's normed on a different population, but also grammatical morphemes, syntax differs, vocabulary, order of acquisition. So there's a lot of, for most assessments, you really can't translate. There are a few where this may be acceptable, and we'll talk about them, but really they're only acceptable because there's a lack of another really good alternative. And that is more of a reflection of our field still not having what we as professionals need to truly assess bilingual children. So for a child who is a dual language learner, it's critical to absolutely assess in both languages. So we want to make sure that, I see this very often, that a child is getting a school evaluation and they see if he qualifies for an IEP, and they only assess in English. It's like, well, this child has actually really near age appropriate language skills in Spanish, and maybe doesn't need a self-contained classroom, and would benefit really from being with typical peers and maybe some pullouts. But they are only assessing the child in English. And so it's really important to assess the child in both of his languages. And we know that children, bilingual children who truly have language impairment, will present with patterns of language impairment in both languages. And so I see that also with children who have hearing loss, but also have a specific language impairment. Really, technically they can't have specific language impairment if they have a hearing loss, but because specific language impairment by definition is a language impairment without a known cause, but just saying a child who has likely a language learning disability, or a child who has difficulty learning language that is beyond what would be explained based on their audiological history. I see those difficulties learning language in both languages. And so if a child is age appropriate in one language, he doesn't have a language disorder. If he's delayed it would seem to be delayed in one, but not the other, that's a lack of just sufficient exposure. And we know that bilingualism the impact is really distributive. And this distributive nature of language in children who are bilingual, and we need to take into consideration the impact of combined linguistic and phonological systems. And we'll talk later this session about what true bilingual language acquisition looks like compared to what disordered bilingual language acquisition looks like. And it's important to be able to recognize what that looks like on both formal and informal assessments. And as an example, talk about assessing vocabulary. So it's actually not sufficient or valid to test a child in both of his languages using standardized testing for each language and then compare those scores with just monolingual norms. So this is where it gets complicated, because you're like, okay, well, you just told me you need to assess in both languages, but it's not enough to just do that. Because if you are assessing a child in Spanish, but then also in English, let's say in English you give him the MacArthur-Bates, or you do the EBT, you can't just compare those scores then to monolingual norms of children who've only been learning English and consider that valid. Because this doesn't provide information on the relationship between the two languages or the sum of a child's language abilities. So that's where using true bilingual assessments, and we'll talk later about what are some examples of those, are better. And so for vocabulary, for example, there is a bilingual version of the expressive receptive one where the child would get credit for responding in either language. And so clinical application, we know that a bilingual child's vocabulary knowledge is distributed across two languages. And I see there's some people in the waiting room. Oops. Okay. A bilingual child's vocabulary knowledge is distributed across two languages. And he's acquiring those two sets of vocabulary at the same time, but they influence each other. And also when considering total vocabulary, we know that bilingual children will match or exceed monolingual children's vocabulary growth. But if we only are counting their English words, for example, and we don't give them credit for any of the Spanish words they know, then their vocabulary may appear smaller at first. And so if only testing a bilingual child in one of his languages and comparing those norms to monolingual pairs, he may score lower at first. If you score it for an older child, at that point they typically have caught up, and we know that bilingualism doesn't cause a true language delay. But in the beginning, a young bilingual child's language knowledge is spread across his two languages. We know that there are limitations of standardized assessments. So we need to always, regardless of who the child is, be considering, is the standardization sample representative of the child's background? And for our bilingual kids, very often the answer is no. And so we need to be cognizant that even a formal assessment that is developed in Spanish, that may not be appropriate for every Spanish-speaking child. We have to consider the child's background, linguistic profile, etc. And norms are really difficult to develop, true bilingual norms, because if we think about bilingual children, they're all so different. And so if we think to before lunch, we were talking about children who can be either sequential, simultaneous, they can minority language at home, one person, one language, time and place. So all those different language policies, language strategies can impact how rapidly a child is acquiring each of his languages. At the end of the day, they can acquire both, but in that process of learning language, if the child is exposed mostly to one language and not the other, he will learn that language more. And so it's really hard to get good bilingual norms. Some tests have tried to do so fairly successfully by having just a really wide variety. But bilingual children are really different from each other in terms of duration of exposure to each language. So we're going to briefly go through some formal assessments. And Becky, if you could pull up this poll. So I want to see which of these assessments have you used with Spanish-speaking children? Okay, great. So a lot of you have used at least some of these assessments. I see it just does not like polls. Okay. Hold on one second. I think we might not do any more polls after this. Okay. All right, I think we're back. All right, so first we're going to talk about, so these are just not a completely comprehensive list, but a list of some of the more familiar bilingual or Spanish assessments. So first we're going to talk about the MacArthur-Bates. And so you may be familiar with it in English, and many of you, it sound like, had used the Spanish version as well. So the version that is most readily available is actually normed on children from Mexican families. They do have other countries available as adaptations. You need to contact the company, but it's not, the version that just comes when you order it is actually based on children from Mexico. And so because of this, some of the words may differ, and you may have to adapt what word the family uses. When we get to our vocabulary section and intervention at the end of this, I'll show you an example of how it can be adapted. So it is norm referenced, but again, norm referenced specifically on that population. But what about bilingual children? So there are different schools of thought, whether you should count just their Spanish words, then separately their English words. But technically, the best way to do it would be to add up the total vocabulary. So to add up all of their words in Spanish, all of their words in English, but be very clear on your assessment results on what you're doing. So this is their total number of words in English, their total number of words in Spanish, and this is the total number of words between both languages. But if looking to give a score, it's actually most appropriate to compare it to monolingual norms, although really, again, then you're not truly comparing to what the norms would be. But if you're just trying to get in a rough age equivalency or a rough idea, it's better to add up the vocabulary between the two languages. So a test that actually was normed on bilingual children, the expressive and receptive one word, picture vocabulary test. So they have lingual versions, they can start at age 2. Sometimes 2-year-olds are a little hard to give this to, but definitely by age 3. And it's intended for children who are bilingual, and the child is permitted to respond in either language. So I think you can approach it as this is a good way to get an idea of their vocabulary level compared to hearing peers, sort of as looking for a score. And then the MacArthur-Bates is more just informational. So here's their total number of words in Spanish and English. You can see do a lot of the words overlap because the expressive and receptive one word is not a vocabulary inventory by any means. it's more just looking at how does this child's vocabulary compare to compared to peers. Whereas MacArthur-Bates, you're really looking at a total number of words that this child understands and says. So again, I don't love giving scores with MacArthur-Bates, but the more technical way to do it would be to report the total vocabulary. Okay, so language assessments.
Hi there, can I interrupt real quick? We have a question in the
Yes.
chat.
Yes.
If you're totaling all words on the MacArthur, would you count a word once or twice if they say it in both languages?
That's a great question. And so when we get to the vocabulary intervention section, we're going to talk about the difference between total vocabulary versus conceptual vocabulary. And there's two different schools of thought. I prefer to give the child credit for total vocabulary. It's also infinitely easier to score because to truly count conceptual vocabulary, you would have to compare the two and say, okay, the child knows this concept in this language and this concept in this language. I'm only going to give them credit for one. And sometimes there are, multiple words for different concepts, and we'll go more into that in the vocabulary section, but it would be a lot more complicated to score. I think it's good to just sort of, in general, take a look and see, does the child typically know the same words in both languages? But I would count total vocabulary. If the child knows both agua and water, I'll give them credit for 2 words. But really, with a bilingual child, the best evaluations are those that are really descriptive. So you're describing the total number of words in each language, and then you're saying, okay, well, this is the total number of words when you combine both languages together, and then making a note that in general most of the words seem to overlap. He has mostly, if he has the concept in one language, he has it in the other, or the concepts seem to be different. But that's a great question. There's different schools of thought, but that's in general how I tend to do it. So I really wish that we had the reel available in Spanish. I've actually talked with a colleague, friend of mine, Aliat Alfano, about how we need to make an adaptation. But right now it's not available. It's available only in English. And actually we have the Reel 3 at our clinic, but they just came out with the Reel 4, I think in August. And it's just a basic, it's parent report, clinical observations for really young children, and designed to identify infants and toddlers with language delay or impairment. It's not normed on Spanish-speaking children, but because we don't really have other great options, I tend to use it up until the second to last page, sort of towards the bottom, where it really gets more specific into English. And when I say basically up until the child's like 2, 2.5, just because we really don't have other great options. But I always put in a disclaimer that, full paragraph, you're welcome to copy it word for word, but that the responses are based only on Spanish equivalents and are reflective of the child's listening spoken language skills in Spanish. Or you can say this child is exposed to both English and Spanish, and these responses are reflective of their language competency in both languages. And the Reel 3 is, it's looking more at overall early language concepts. And so because we don't have anything that's specific for bilingual or Spanish-speaking children for that age, that's a similar assessment. I do translate it, but we'll put it in a disclaimer. And similar with the Rossetti. So it's not normed, but it's a criterion reference measure for the same age range, 0 to 36 months. And again, developed based on English-speaking children, not Spanish, but a lot of the items, really they would be similar if they were adapted up until, it gets to the last few scales. And so I do use both of these, but really more because I have to for insurance purposes. They need a score, but and it gives you some good information, but it's definitely not the most accurate because it's not normed on. They're not really based on Spanish language development. The PLS-5 Spanish, or there is, our clinic actually still uses the PLS-4 Spanish. That is normed on younger children, but I find that it far overestimates language skills and gives credit for play skills, for nonverbal communication, especially early on. And for a really young child, I don't think it's very accurate. And so I tend to, for a child under the age of 3, I'll use more of the Reel and the Rossetti. Well, I do like this test, the Self P2 Spanish. This starts at age 3, and it's not a parallel edition to the Self P2 in English. Or sorry, it's a parallel version, not a translation. So really, it truly is an adaptation, and it's normed from 3 to 6'11", and it's normed to both monolingual and bilingual children. And so when the child turns 3, I found that this is a better assessment than the PLS. This is another assessment available. My clinic actually doesn't have this one, but my friend Aliette uses this a lot in her clinic, and it's normed a little bit younger. I think she said that it's still sort of hard to use until the child's about 3. Then for older children, there's the Self-4 in Spanish, and all of this is available as a handout. The BESA, which I do really like, it's normed, this is one that is specifically normed for bilingual children. You can give it both in English and in Spanish, and my biggest complaint about it was that it really didn't start till age 4. It's like 4 to 6'11", which is a pretty narrow window, but they are developing norms down to 3. And it was specifically designed to identify phonological and language impairment in bilingual children or English language learners. And so I like this assessment a lot, but for some children, it's very difficult. So the child has to be near age of, a 4-year-old who was just implanted is not going to be able to take this. And so speech assessments. So I used the Goldman-Frista Test for Articulation 3 in Spanish, and it's fine. It's a true adaptation, not just a translation. And I found it to be pretty useful. There's also the CPAC in Spanish. And then speech perception testing. I know Chrissy's going to go a lot into this, but the biggest takeaway is never want to write could not test. So there are Spanish speech perception tests available. Here's some of them. Ones that I've given in clinic, I've done a lot with the open and closed set task. It was one that was released, I think last year, from Medell, and you can use it with children as young as 12 months. I've never had a child younger than like 18, 20 months actually be able to do it, but there are scores for children as young as 12 months. And a picture, they both point to pictures, but then also have to repeat words back. And I found that to be a good one. Here's a list of some other speech perception tests. But this is also a survey. Becky, maybe this could be sent out in email form so they could click the link. This is that both Chrissy and Aliette had developed, looking at what assessments are typically used in speech language pathology and audiology for bilingual patients. Okay, so informal assessments.
Sarah, if you can,
Yes.
At the break, copy that and then post it
Put it
in
in
the
chat.
that would be great.
Yeah, absolutely. And I see there are a couple of questions in the chat. Trying to go to that. Okay, so we have, okay, we answered that one. Oh, you have the Real 4, Becky?
Yes, we do, and I just used it a couple of days ago.
I'm glad you like it. Yeah, we have to get it for our clinic still.
And it's much easier to manage
than the 3.
It doesn't have the expressive and receptive columns next to each other. It has the
that is so annoying. Yeah,
it has the receptive set and then the expressive set.
Good. And okay, Sophia said that. Yeah, so you're talking about language samples. That's what we're going to get to now, that really these formal assessments I give for insurance purposes. They're sometimes really useful information, but informal assessments such as language samples are really where the meat of my diagnostic information occurs. And then, oh yes, didn't give credit. Aliette's the one who, along with David Ertmer, developed the Spanish version of Open and Closed Set. I think those are all the comments. Okay, so let's go back here. Okay, So informal or non-standardized assessments are often what's going to really give you good information about the child's language skills, the child's language learning abilities. And especially for children, so we're talking really about children who speak Spanish, but also for children who speak other languages where maybe there's nothing available. So I know I'm complaining a lot about how we don't have enough for Spanish speaking children, but there are languages where we don't have any assessments for. And so for those children, you really do need to use informal or non-standardized assessments. So language sampling is a really powerful tool for children who are linguistically and culturally diverse, especially children who are dual language learners. You can really see how the two languages are impacting each other. My favorite resource are the castles, so college acquisition scale for listening, language, and speech. It's a product made by Sunshine Cottage, and they, for many years, were only available in English. And then magically, the year I graduated and took this job as a bilingual SLP, they came out with the Spanish version. That was the biggest gift. I think I started in June and they came out in July because I would be lost without them. Because it's not a translation, it's a true adaptation and find a picture here. So it really, it divided by age and then also parts of language and provides all the different parts of speech, language that the child would develop during each age range. And they are great. I use them every day for therapy and then also doing language sampling with assessments. So here's an example of here's a example of a language sample. And so this is Diana. She at the time had just turned 3 and had her implants for a year and a half. She was implanted at 18 months. And so you can, even without speaking Spanish, she has some longer phrases. She does make some grammatical errors still, but she's definitely developing a good amount of language, using some past tense. This is part, I think it's funny. She said, quiero pegamento de vaca. That's what she calls Elmer's glue because it has the little like bull or cow looking logo. And so here, plotting on her castles, and these are her actual castles. You can see they're not all pretty. Just sort of marking things as she goes, and a lot of this was marked also just from her therapy sessions. Here's an example of language sampling with a bilingual child. So in the left-hand corner, I prompted him in Spanish. As you can see, the majority of how he responded was in Spanish, but he also said like, uno dog, tres duck, what's that? And then, so some that were a combination of English, Spanish, and then some that were just English, and everything I responded to him was in Spanish. And then I switched to speaking English, and he switched to mostly English, but he still said like me, yo, and then Sarah, I need marcador, like I need marker, but marker in Spanish, marcador black. So you can see how the two languages do influence each other. Sometimes his word order was more in Spanish, etc. And this is actually a child who has autism as well. And so you can see his English and his Spanish really are at a pretty similar linguistic level. Spanish, English. And so also wanted to make you aware of SALT software. So it's software that sort of standardizes the process of language sampling. And it is available in both English and Spanish and has really great databases and can measure a wide variety of things in language sampling. And dynamic assessment, this is really looking at the child's ability to learn novel language skills in brief teaching sessions. And it can be really beneficial for children who are dual language learners because what you're looking at is their ability to learn, and their ability to learn language can really help you distinguish between language disorder and a language difference. And this is used a lot in children who perhaps don't have hearing loss, but who are suspected to have specific language impairment. And I use this a lot of times to see if the children with who are working with who have hearing loss perhaps also have an additional language learning disability, have more difficulty learning language than would be expected. And so really emphasizes the learning process and looking to see if the child's able to make changes in short teaching sessions. And it's really popular in the field of sort of bilingual speech language pathology because you're able to simply look at the child's ability to learn language, and that can tell you a lot about whether the child is a typical language learner, even if you don't have a good way to fully assess the child's language skills. This is especially great for children who are speaking a language that perhaps you have no assessments for. So the basic framework is pre-test, teach, post-test. And we wanted to see, so specifically, this is something I've done for a while, but didn't really necessarily have research on it specifically for children with hearing loss. So when doing a presentation with Aliette this past summer for HE Bell, we were talking specifically about assessment, really dove into the research and found that this is a thing people do. So, differential diagnosis of language learning difficulties in children with hearing loss is possible using dynamic assessment. So looking to see, okay, we know this child has language delays because he has hearing loss, but is this child having a disproportionate level of difficulty learning language? So does this child have also a language learning difficulty? And especially for our dual language learners, there's a lot going on. They're learning English, learning Spanish, the child has hearing loss. Are we trying to see, does this child also have difficulty just learning language? Non-word repetition tasks are also really effective and can provide very valuable information in bilingual children, and difficulty with non-word repetition we know is a clinical marker for children with language impairment, and also measures verbal working memory. And it's really useful for bilingual children because it looks at the child's ability to learn new words. And you may or may not know, there actually is a Spanish version that is available, and it's free. There's a link here, although I don't think you can click the link, but I'll put it in the chat. And we know that we can't just take a non-word list in English and use it with a Spanish-speaking child, because the words have to be compiled with the prosodic and phonological characteristics of the word in that language. And we know that children who have language impairment would score low in both. And we do know that, again, looking specifically at children with hearing loss, that difficulty with non-word repetition is a significant predictor for difficulty learning language. Okay, so now very quickly, and then we're going to go into our breakouts. So creating a Spanish assessment protocol. And so I want to stress that this is meant to be followed as a guide and always use clinical judgment. But in general, for a child who's birth to 2, I will use the Real 3, adapted, translated, because we don't have anything in Spanish. I'll use the adapted Rossetti. I'll use MacArthur-Bates for sure, because we do have an official version of that in Spanish. Then I'll also use Castle language sampling. So the Castles do go down to that age range, but again, you can't get a true score. And for our clinic, I know Medicaid requires actual scores, which is why I have to give the Real and Rossetti. Although, those scores, again, put big asterisk, put a disclaimer, because they're not fully valid since they weren't really developed. They weren't developed for Spanish-speaking children. But I found that both the Real and Rossetti, when adapting/translating, can give a good estimate of that child's language skills, and often aligns very nicely with the more informal language sampling and using the Castles. So this is what I do for a very young child. Then when the child is 2 to 3, I'll still use the Real and Rossetti, MacArthur-Bates. It is normed only up until 30 months, but often continue to give it, although you can't give a percentile, but continue to give it until the child has really used the majority of the words on the test. Got some in the waiting room. There you go. But then I'll do more language sampling, dynamic assessment. You can also give the TELD 3 at 2. Our clinic doesn't have it, but I know some do. And then I'll occasionally at this age use the PLS 5 Spanish, or well, our clinic uses the PLS 4, but now the PLS 5 if you need something behavioral based. But I'll often have to note that it overestimates language skills, and again, don't love it, but something if you need to. And then, so 3 to 4, what I'll do, I'll give the self P2 in Spanish, and then if the child really can't complete the self P2, if that's too difficult and we just can't get a basal, then I'll sometimes give the PLS 5. I found the PLS 5 or the PLS 4. The PLS is more accurate as the child is older, as there's more of a significant language delay. That makes sense. But again, Castle's language sampling, dynamic assessment. I'll start giving the non-word repetition task. You can do the expressive receptive one word. You can technically give that at 2. I found kids are typically a little too young at that point. We'll do the Goldman Fristow. Again, you can start at 24 months, up to wait till 3. Do a phonemic inventory. And if the child is really delayed, I'll typically just give only the real Rossetti and MacArthur Bates. So 4 to 6 or 4 to 6-11, we'll do the BESA. And like I noted before, they are coming out with norms that are down to 3. So I would then give that to a younger child if I felt they could do it. TEL 3, you could use self P2, the PLS if you feel like they really can't do either of those behavioral measures meaningfully. And again, Castle, SALT, non-word repetition, expressive receptive one word, Goldman Fristow. And then over 7, just sort of continue on receptive, expressive, Goldman Fristow, self P4 or self 4, TEL 3, Castles. Okay. So how to assess a bilingual child in English? So, assessing a child who's just speaking Spanish, we talked about that up until now, and then English and Spanish for Castles, and then same with really the dynamic assessments and the non-word repetition, but giving a formal English assessment. I like to wait until a child's been exposed to English for about a year. But I'll often, if it's been less than that, just sort of give a description in their evaluation, do some language sampling. But often, the question is, well, what do you even report for a test? Like if you're giving them the PLS 5 in English and self P2 in English, and talk about the disclaimer in a second. So tests in English that are normed on bilinguals. So we have the BESA, which I do really like, but it does have a limited age range. You can give the expressive and receptive one word, although they accept responses in Spanish, so you wouldn't really get a separate English score. And then, interestingly, the PLS 5 Spanish is really only for Spanish monolinguals or Spanish English monolinguals, because it's actually not appropriate for English only monolinguals, or, well, that would be obvious, but even English dominant bilinguals, because the way you have to administer is administer it first in Spanish, and then only the missed items are re-administered in English. So it's all that to say, it's not a good way to judge a child's English skills. Okay, so I would say the best is the BESA.
Sarah, do you know if there's a Spanish version of the self 5?
They were supposed to be coming out with one and then never did. Our clinic definitely doesn't have one, and I don't think it's out yet. And last I heard, they were planning on, I think, just skipping, calling it the self 5 and going right to the self 6. But no, as of right now, to my knowledge, there's nothing. But yeah, so I would include this disclaimer. And so what I would often do is if the child has had more than a year of exposure to English, such as the child's, 5 has been in preschool in English, I'll give the self P2 in English, but huge disclaimer all over that this is not normed on bilingual children, and it just more of a description of what the child could do, and then give the BESA. And so always include disclaimer, talk about not for diagnosing a language delay or disorder, is just for information about language dominance, trying to find out, which language are they dominant in, and also a rough idea of English proficiency. And both standard scores and age equivalencies really are statistically inaccurate for this population. But an age equivalency could give more information than a standard score at that point, but they're really, because a child is not, a standard score reflects the child's performance compared to average on normal distribution. But if the child's not represented in the sample, then you're really not comparing apples to apples. So a standard score really isn't accurate. And whereas age equivalencies reflect the child's raw score for that age, and they're at least useful, but they really are misleading and don't take into account sort of normal distribution. So all that to say, the best way to assess a child's English skills are informal assessments, language sampling, language sampling, language sampling. But if you want to give something formally, really need to wait until the child's had at least a year of exposure. And so collaborating on assessment, if you're using interpreter, we talked some about this before lunch, in having them be really trained on how to do it and involving them completely in the SLP is the only one who can be scoring and analyzing. Okay, so now we're going to do some breakout sessions. So I'm going to have you take what you learned, and team 1 is going to talk about Leonardo. So he's 16 months, monolingual Spanish-speaking family, bilateral CIs at 9 months. What assessments would you give? So both formal and informal. And then team 2, you have Julia, 28 months. Mom speaks English, dad speaks Spanish. She's a dual language learner, bilateral atresia at 4 months. What assessments would you give her? Team 3, Carlos, he's 3.5. Minority language at home. He started 6 months ago in a deaf and hard of hearing preschool, but he had a late ID of profound loss at 2.5. So he was identified about a year ago and implanted 8 months ago. What would you give him? Then we have team 4 with Mateo. He's 4 years, 2 months. His parents speak English to him and he speaks Spanish with grandma. He's in a Head Start. He passed his newborn hearing screening, but was just diagnosed with ANSD, mild to moderate thresholds. And then team 5 has Isabella. She's 5, maternal language at home, minority language at home. She's in a mainstream kindergarten. She got her CIs at 18 months, and we're looking to graduate her from AV therapy. I'm sorry, I thought there were 6 of them. I think there's only 5. Okay, is everyone in breakout sessions?
Sarah, real quick before we go to breakouts, there was
Yes.
one more question in the chat. It says, if a child only has 1 to 3 years in their second language, our expectations of language skills would be different than if a child has 7 to 8 years being exposed to their second language. Is that right?
Yeah, so if a child has only been exposed, I'm just reading this in, for 1 to 3 years in their second language presentations. Yeah, so absolutely, and that's where doing formal assessments are really difficult for bilingual children. When I the best is the base, but really a formal assessment needs to have lots of disclaimers, and you can't, it's just for informational purposes really. And language sampling is going to tell you a lot more information. And yeah, absolutely, a child who's been exposed to their second language for longer, after 7 or 8 years, at that point, I think you absolutely could give assessments that have been normed on English monolingual peers. Still include a disclaimer, but I would feel more comfortable with those scores versus giving the self P2 in English to a child who's only heard English for a year. Does that make sense?
So Sarah, do you only want 5 breakout groups, or do you want?
Yes, I'm sorry, can we do 5?
Yeah, let me recreate this. Okay, and Sarah, you're going to be in a group, okay?
Okay.
I can move you into a room by yourself if you want to. I'll move you into a room by yourself, And that
Okay,
way,
sounds good.
all right. Hold on just a second. Okay, I'm going to open the rooms, and you all have what, 7 minutes, 8 minutes?
Let's do, I think 5 is enough.
Okay, I don't think 5 is enough. I'm going to give them
Okay, let's do 7.
Okay, and then you'll get a 60-second warning
Okay,
when it's going to close.
and then they'll automatically come back here?
Yeah.
Okay, so pick someone to be in, to be the spokesperson for your group, and let me go back and share. Will they be able to see the PowerPoint?
They
If I
can
share
look in their
this?
handouts. They can look in their handouts and see the PowerPoint.
Okay.
Okay.
Some are shaking their heads. Do you all have your handouts?
They should. I sent links out to them yesterday.
Let me just share the screen.
Okay.
Will they be able to see the screen?
No.
No. Okay, I'll put the information in chat. Will they be able to see the chat?
No.
The name of the handout, it's just the main PowerPoint. Okay.
Okay, I'm going to open the rooms. Miriam, where are you supposed to be? Did you not get?
Becky, sorry, it timed me out and I had to rejoin, so I'm not sure where I'm supposed to be.
Okay. I'm going to put you in a different
Sorry.
room then.
Thank you.
Okay. Okay.
Yeah.
I'm just going to, so I'm going to make you the host, and then who's unassigned? People leave and then they come back and then they don't get in the room, or they time out, or I don't know.
Yeah,
Anyway.
people who came back late.
Yeah, Jill's taking attendance. So, okay, so I'm going to leave this and then make you the host, and then I'm going to go set up Chrissy's. And it's
Okay.
if you're the host, you'll get a message saying, do you want to continue the breakout room, or
Okay.
do you want?
End it.
Okay.
Okay, sounds good. Thank you. And then, wait, do I need to record?
If it stops recording, yeah, you do need to hit record. But I gave you a record. I'm going to make you the host. So,
Okay.
but I don't know if it'll stop recording or not.
Okay, sounds good. Okay.
Right. Did you get kicked out of your room or what happened?
I didn't get kicked out of the room. My computer turned off completely.
Oh, okay. Well, I put you back
It
in another one.
overheated.
It's
Uh-huh,
okay.
it overheated.
We're almost finished.
Yeah, and I'm not too worried about the credit. You know, I just wanted to be able to learn about the assessments and,
Okay.
you know.
Okay.
Hello. Okay, we don't have everyone back now.
So Sarah, I'm leaving,
Yes.
so just make sure it continues to record.